Just that competition is enough, that setting up competitive programs and reward systems is going to help us do better as an entity or as a hospital. I don't think it is. And we do it with all kinds of things, and we think the competition is going to bring up the entire organization. In my experience in 40 years in healthcare, it does not. And I think you would find pockets of demoralization and sadness almost in the staff. They feel discouraged, they don't feel heard. They're trying their best to take care of patients well, and they're still not doing it, and they just get very, very discouraged. There may be higher turnover rate than normal. You're just going to see an unhealthy culture reflected in a number of different ways. It just doesn't set up the fact that if you're not the high performer, then you must be the low performer. It's a demoralizing thought, even though no one is saying that necessarily. Co-opetition refers to the combination of cooperation and competition. And in most cases in healthcare, I've been in healthcare for 40 years, most organizations rely heavily on competition as a means to motivate people. This involves both, where you don't have one winner and everybody else has lost. My belief is that competition alone doesn't work. There are many organizations that have a lot of structures around rewarding the winners, and their outcomes in general are not that great. So it's a strategy. If we don't learn in a continuous improvement mindset and we just keep on rewarding the winners, we've just lost our opportunity to learn from them, that we could do something that you're doing that's making all this work, because usually there is something they're quietly doing, no one's noticing, and there it sits. It's like the golden nugget you're not paying attention to.
Welcome to Beyond the Bedside, the podcast where we explore the people, ideas, and leadership practices shaping the future of healthcare. I'm your host, Michael Duggan, CEO of Peak Recruiter. Today, we're exploring a concept that challenges the traditional way healthcare organizations think about performance. We call it co-opetition. Our guest, Shirley Bomhoff, describes co-opetition as a culture in which competition and cooperation exist simultaneously. Competition helps an organization identify its bright spots, the teams producing exemplary outcomes. Cooperation ensures that those teams show their practices, mentor others, and help spread that success across the organization. It's a shift away from labeling departments as winners and losers. Instead, there are bright spots and learners all working towards stronger performance across the system. Our conversation will examine how this mindset promotes continuous improvement, why the way an outcome is achieved matters as much as the results itself, and what leaders can do to create reward systems built around learning, teamwork, and sustainable improvement. We'll also discuss why shame is an ineffective leadership tool, how organizations can avoid gaming performance measures, and why healthcare success must always be recognized as a team effort. Shirley, welcome to Beyond the Bedside.
Thank you, Michael. Glad to be here.
Glad to have you here. Thank you so much for taking some time out of your day to join us. Shirley, when most people hear the word, competition, they think of winners and losers. And you're proposing a culture built around bright spots and learners. Can you walk us through what co-opetition means and why that distinction matters?
Sure. So co-opetition is the combination of both competition and, I'm not saying this right. Okay. Co-opetition refers to the combination of cooperation and competition. And in most cases in healthcare, I've been in healthcare for 40 years, most organizations rely heavily on competition as a means to motivate people. This involves both, where you don't have one winner and everybody else has lost. You actually have people who are recognized, or units or departments, as bright spots. And then they are identified by what are they doing differently? What is happening with them? And what can we learn from them? So like you said, in the end, we have a winner or a bright spot. And then we also have everybody else learning from the bright spot, which then elevates the entire organization.
And why does a culture of co-opetition enhance the effectiveness of a healthcare system?
My belief is that competition alone doesn't work. There are many organizations that have a lot of structures around rewarding the winners, and their outcomes in general are not that great. they may be mediocre or a little bit below mediocre. So it's a strategy. I think it was well thought out at some point in time, and it's a great idea. But really, if we don't learn in a continuous improvement mindset, and we just keep on rewarding the winners, like the unit of the quarter, or we've got the employee of the month, or that's all great. I'm not saying don't do that, but then you don't walk away and go, yay, I'm the winner, and everybody else lost. Mm-hmm. You will be off your pedestal next month. Watch for it. Because it will happen. You're high now, you're going to be low later. So, if you have a healthcare organization with a unit that's doing great, let's say with CLABSI SIR, and they get rewarded and recognized to the board, and then they walk away. Well, we've just lost our opportunity to learn from them. What are you doing that might be different? What are we missing here? That we could do something that you're doing that's making all this work, because usually there is something they're quietly doing, no one's noticing, and there it sits. It's like the golden nugget you're not paying attention to.
Yeah, I love that idea of building off the momentum of success, surrounding successful people with other folks, right? Because that kind of breeds more success. Let's talk a little bit about what leadership, can start doing today, right? People watching this are hopefully going to come away with this with some actionable items that they can implement. So from your perspective, what is one thing a healthcare leader can do this week to begin creating a culture of co-opetition? When
you first identify your high performer, let's call it, even though that's not the greatest term, because then everybody else is a low performer, but you find your bright spot, and you make sure that you're not rewarding normal variation. First off, is this like a little blip in the data and they look good this month, but they really haven't sustained? So identify your bright spot that has sustained over time. And from there, of course, recognize them, and then invite them and expect them to mentor others. What are you doing that we might not be doing? And study that area. What are they doing with leadership? What are they doing with their processes and structures? How are they treating each other? What's their culture? And then learn from them to say, you know what? I see the gaps I have. I need to learn from you. They could start that tomorrow, because everybody's got reward systems all over the place in hospitals.
Yeah, I see that too. So where should an organization begin? Like maybe one metric, one department, or kind of one enterprise-wide priority?
My suggestion would be to start with something of strategic importance, so that you have leadership buy-in and leadership support, and that they understand what you're trying to do and they care about what you're trying to do. And then I would start small. I would start with, if you have a dashboard and you've recognized a unit doing great, or you're in a system and one hospital's doing really great, go and find out what they're doing, reward them, and then recognize them, and then find out what are they doing differently from what we're doing. Are we missing something? Mm-hmm. And most likely you are.
Yeah, it's probably not, some sort of groundbreaking difference either, right? It could be just little, devils in the details, as people say.
Yeah, and a lot of times when I've done this, a lot of it boils down to leadership, with the leaders setting the culture of, humble inquiry. We're all here safe to talk about what's going wrong. We care about each other, all those things. And we also have crucial conversations when needed. We hold accountable. We're going to do something. They're good with change management. So leadership makes a huge difference. Mm-hmm. And many times that unit is doing well with a whole bunch of other things other than the one thing they were getting rewarded for.
Well, that makes sense.
With balls, happy, CLABSI, CAUTI. It's like, how are they doing well with everything? Well, you got to look at the leadership and the informal leaders.
Absolutely. Yeah. And that culture. Yeah. Mm-hmm. Success really is kind of a culture, right? I've been part of organizations before that, I don't want to say are toxic, but there's just so many barriers in how people talk and work with each other that prevent the team from getting the big wins. Mm-hmm. So when these folks are thinking about, okay, where would I start? Are there certain characteristics, or I guess what characteristics make a performance measure appropriate for a co-opetition pilot? Where are some of the better ones to start?
Mm-hmm. In my mind, it would be any outcome that involves human participation. If you're looking at an automated system, like maybe, I don't know what it would be, the robot that delivers the linen, that's probably not going to be a co-opetition thing. That's going to be what robot did you buy. But if it's about humans and how humans are behaving within a process, co-opetition works really well. Part of it has to do with, and maybe people have heard of this, the positive deviant approach, where there's a societal behaviors going on within that process that's making it work well. And so anything that involves the human factor is where I would start.
Yeah, I love that idea. And plenty of places, of course, to start with there within the workflows of these hospitals.
Yeah, absolutely.
Okay, so you pick an area and or some things to start with. And how should leaders introduce the concept so teams, don't interpret this as just another ranking exercise?
Don't call it a program, number one. This is not a program. This is a culture. So we're in a continuous improvement culture, and we're going to continually improve ourselves. We're going to continually improve our outcomes. We're going to learn from each other, and the whole organization is going to rise. So if you call it a program, it's already not going to go. Nobody wants a program. We have programs, and they all sit siloed in the program. This has to be a culture and a fabric of how we do everything we do in healthcare, including having your own mentor and improving yourself, improving your unit, improving each other.
Absolutely. It makes a lot of sense. So, we identify some high performers, bright spots, and we think about, some areas to start with, and asking these people to now mentor or share their success or help spread that across the organization. What kind of support does a bright spot need before it can actually mentor other departments?
That's a good question. If the bright spot has a leader who's kind of ego driven and wants to be the winner and doesn't want anybody else to win, that's going to be a problem. So you need to make sure that the leader who is leading that area understands humble inquiry, that they are open to listen to what's problems are happening on the other unit, that they are wired to help each other and help other people. There is a peer coaching model that could be taught to leaders too, that you can learn how to do this with the certain steps that are done, where you're basically peer coaching to improve the outcomes of the department or the unit. And that can be taught. And there's also ways to find out, do you have mentors already in your organizations who really could be considered master mentors? They're out there mentoring all the time. They are there. You got to find them. They're quiet. You don't know they're even doing it, but they're doing it. And so finding them, and you start to train, you start to educate and train and coach new mentors, who then get intrinsic joy out of mentoring. If you're not getting the intrinsic joy out of mentoring, you're probably not going to want to mentor, because you know what? I want to keep winning. I don't want you to win. I don't want you to end up being better than me. No.
Two very different points of view for sure, right? I mean,
yeah. Because sometimes that can happen. All of a sudden, the person you're mentoring is, doing way better than you are, and that's okay.
Yeah. Yeah, I can see how people might have some naturally mixed feelings about that. But if we're, sometimes clients talk about a just culture or just all these different types of buzzwords you hear in the industry, right? But it all goes back to that culture and, hey, we're here to win together and to support each other.
Yeah.
Okay, so we've identified, some bright spots. We've got the team prepared to be the mentor. So how should leaders select, learner teams, those areas that could benefit from what they're doing, and create that, the environment for the knowledge transfer?
Yes. So you can set up a criteria matrix where you can select your learner teams. The team that's performing the worst probably won't necessarily be your learner team, because they may have other structural problems. They may not have stable leadership. They may not have a stable nursing, staff. They may have other things going on, other huge changes happening where they cannot take on another thing. So make your criteria. Score your criteria to see who are going to be apt to be the best learners here, open to doing this, and have an opportunity to improve. If they're doing really well with what you're trying to improve, that's probably not for them. But yeah, criteria based is really good. I've used that before in other selection matrix, and it's very helpful. Including, is the president and CNO of the hospital behind this effort? Yes or no? Or how strongly are they behind it? You've got to have that too. So
Absolutely.
It's okay. Get your priority matrix going, your criteria, and score the units that you want to evaluate, and then pick a couple that are scoring where you want them to.
Okay, that makes a lot of sense. And so you're working with a bright spot, and you identify some practices that they're doing. Mm-hmm. What happens if one of these practices works well in that department but doesn't really translate to one of the others?
Yeah, sometimes certain practices won't translate because the units are too different. So something working in the ICU probably won't work in med-surg necessarily. But let's say you have like units and it's not working. The first thing to figure out is why. Is it that the leader is not feeling equipped to do change management? Is it that there's some other factor going on? What is going on that's making it not work? It's not good to give up too quickly, because maybe it's just a resistance to change, or I'm not sure how to inspire my staff to do something different. They don't want to do it. So finding out what's the barrier, and then try to help remove the barrier. Here we are in continuous improvement again. What is their barrier, and then how can we help them?
Absolutely. I think it's important for people who are listening to also recognize that we're not always amazing the first time we do something. Right? There is that resistance to change. I see that a lot, right? I mean, we bring in interim and perm folks to these organizations, senior leadership teams. Often we're told that people want change, the boards want X, Y, Z. But change is hard, right? And you see that one step forward, two step back. And realistically, people will get better the more that they do something. So I think that persistence of not giving up too quickly and just trying to figure it out is a really good lesson they can take away. To that, how long should leaders allow for spread, right? The spread of these good ideas, success, before evaluating whether that approach is successful and working for them?
In my experience, 3 months, if you're waiting to see if something has improved a metric, and it's actually happening, first you've got to know they're doing what you suggested they do. Then if they are, in 3 months, if you're getting a monthly data point, you should have a directional idea that things are getting better. It's only directional, though. So it's like what Cotter said, about change management. Celebrate the early wins, and that is truly just an early win. And then you wait to see, and you say, great, look, we've got 2 data points here that are moving in the right direction. Great. And now we've got a third. And then you watch it. And you see whether it's sustaining over 6 months, 9 months, 10, 12 months. 3 months isn't enough, but it's enough to say, good job, something's moving in the right direction.
Yeah, and are there measures that kind of show that co-opetition is becoming part of the culture, or is it just the quantifiable improvements that you're making in XYZ score or area that you're focusing on?
I would say that if co-opetition stuck and actually was throughout the organization, the whole organization should be doing better in most everything. You could measure things like number of units, the process measures, number of units being mentored by a bright spot. There could be some process measures in place, but the whole organization, there should be no metrics of concern. You should all be a medium quartile or better if we're doing this. There is going to be a bell curve. Everybody's not going to be at the tippy top, but you're going to move the whole thing up where you want it to go. So you will see the whole organization get better in a multitude of different ways, I believe.
Yeah, that makes a lot
morale.
of sense.
Mm-hmm.
Sure, yeah, I'm sure morale, engagement, financial performance ultimately, right? I mean,
because if you feel like you're still in the red and you don't feel like it, you might be compelled to try and say, you know what, we're just going to let that one go. We're not reporting it. I can't take this anymore. Not that really happens, but it could. That you're so upset about being in that spot and don't have any help to get any better that you may be compelled to, do some funny business with the numbers too, which is definitely not good.
Yeah, gaming your own metrics for whatever shareholder or board or, for whatever reason. Yeah, unfortunately, we've seen that a lot, as you can imagine, across the U.S. as well over the years.
Yes.
So it sounds like there's a lot of support that's needed, of course, right? You mentioned the president, the CNO, of course, the leaders of each of the units and so forth who would be doing the daily work. What leadership behavior would really undermine the effort most quickly?
Being punitive and ranking and rating and maybe subtly or subconsciously humiliating the areas that aren't doing well. So I don't think anybody goes out of their way to do that, but it's subconscious sometimes. And the score is put up and you're just all in red and, it just feels bad. It's demoralizing. So if you can say, let's celebrate the bright spot and let's identify where we're going to go first to coach and mentor and then keep going, so eventually nobody's sitting in the red anymore. There won't be anybody there because, if you need to help somebody accountable, they're in the wrong position. Of course, that's going to be rare, but then that's another matter. But in general, the whole organization should be moving in the right direction, and leaders need to just be patient because this takes time. And instead of being more threatening and saying, come on, have these big meetings and stand downs where we're going to do better. Yes, we are. And, we're pounding and humiliating and saying we're the worst in the system. What are you doing? Just say, okay, we're going to learn from this entity that is doing. So what are they doing? Go over and visit them. Go do interviews, look at their environment, go see what they're doing. We want to be like them. And then that takes time, though. And they have to be patient, and they have to try not to be punitive to motivate people, because it won't motivate people. People will just get really angry at leadership for being punitive. Mm-hmm. And that's what's going to happen. So in my mind, anyway, that's what's going to happen.
No, that makes complete sense. And I would say, punitive is not a positive leadership trait. Although I think that when a lot of folks first enter leadership, they think that somehow that's part of what being the boss is. Mm-hmm. And then more matured leaders, realize that it's this kind of servant leadership style. And
yes,
you get a lot more working with them than trying to threaten or bully, if you will, or be punitive.
Yes.
All right. Well, so for our listeners who would like to give this a try, would you mind if I try to lay out a kind of potential 90-day framework and kind of ask for your thoughts on what you would change your ad? Okay.
That would be fantastic. Thank you.
I'll take a stab at it. We'll see how I get. So it sounds like in the first 30 days, right, it's really about this identifying and validating, who are the bright spots and what are we looking at. So things they could do would be to select, a meaningful organizational outcome, reviewing performance variation across, similar units, identifying, of course, the bright spot, validating that the result is sustainable, ethical, and repeatable versus an outlier, and speak with the interdisciplinary team responsible for that outcome. So now the third day is 30 to 60, right? We're in the second part of that, really trying to document the practices behind that result, identify conditions that have been making them successful, then look and select one or two learner teams who could benefit from that, establish how this works or that psychological safety and shared expectations, and create a practical spread and mentoring plan so that we know, okay, what is our actual plan to spread this practice? And then finally, the third month there, or day 60 to 90, really that test and evaluate, right? Begin with limited transfer of practices, provide coaching from the Bright Spot team, monitor both the outcomes and implementation, adapt the approach to the learner team's environment, and then recognize your contributors and share those lessons openly. So I don't know how I did, Shirley, but how does a 90-day approach like this capture how you would begin, and what would you add or change?
It's perfect. I wouldn't change anything. The only thing I would point out is that when you go and observe the current state of the Bright Spot and what are they doing, and you see what they're doing, there may be 20 things they're doing. They've got a good process in place. They've got leader rounding. They've got all these things, reward. They do weekly rewards on no happies this week or whatever they're doing. Boiling down what it is you want to do and share with the other units is important. So wherever the other units' gaps are is where you want to take from the Bright Spot. Don't think you have to do all 20 things the Bright Spot is doing, because they will tell you all the things they're doing. They're doing a lot of things, and that's good. There's a lot of things, but you can put it on an impact effort matrix. Different ways you can evaluate to say, I'm not going to go do all the 20 things because I'm doing 10 of them already. Mm-hmm. Then what do you think really tipped it over the edge to good? And they know. They'll tell you. And then don't try to do 10 more things, because that will fail and be so discouraging to everybody. That was the only thing I wanted to point out.
I love that. Yeah, the idea of not doing too much, right? Or identifying the actual gaps. That makes a lot of sense to focus on that. Mm-hmm. All right. Well, I got some other questions I think people might be interested in if you'd be game. Mm-hmm. One is, I thought is, what is one belief healthcare leaders need to reconsider about competition? Just
that competition is enough, that setting up competitive programs and reward systems is going to help us do better as an entity or as a hospital. I don't think it is. I don't think it is.
Yeah, absolutely. I could see that happening easily.
Yeah. And we do it with all kinds of things. And we think the competition is going to bring up the entire organization. In my experience in 40 years in healthcare, it does not. Mm-hmm. Just doesn't.
I like the idea that this co-opetition is kind of like, that tide that raises all boats, right?
Yes.
Yeah, and I love that.
Exactly.
And I've experienced that in my own network of recruiting firm owners, right? Where you have these peer groups and we go to conferences and we support and learn from each other. And it's by no means punitive since, we don't have reporting structures, but nonetheless, it's just supportive. And I can see how beneficial that has been to myself and to them. And also how that is very parallel to what you're talking about and how we could do this inside of an organization like a hospital. For those that are listening, what is one sign that an organization is rewarding outcomes, but not genuine improvement? Like, how could they tell?
Well, I don't think the whole hospital is going to be doing great with all their metrics, number one. And I think you would find pockets of demoralization and sadness almost in the staff. They feel discouraged. They don't feel heard. They're trying their best to take care of patients well, and they're still not doing it. And they just get very, very discouraged. There may be higher turnover rate than normal, not that that's a thing. It's a thing everywhere, but you're just going to see an unhealthy culture reflected in a number of different ways, which will first be the outcomes. They're not going to have them. They're just not going to have them.
Absolutely. And so when these leaders are talking to their teams, are there a phrase that they should really stop using when they discuss performance? Or
it's hard to not use this phrase because we've used it for a long time, but high performer, if they could start calling it bright spot, it doesn't set up a hierarchy of high performer, low performer, or winner, loser. It's a bright spot. You're doing something great. What are you doing? I'm going to learn from you. The beacon over here, the lighthouse is over here. I like that term better. It just doesn't set up the fact that if you're not the high performer, then you must be the low performer. Mm-hmm. And it's a demoralizing thought, even though no one is saying that necessarily. It's just
but it's a kind of a subconscious belief, right, or a thought. Mm-hmm. And if people believe that they're low performing, that they can't do this, they can't do that, they're obviously much more likely to not do things. So belief is so important.
Yes.
Yeah. I guess what gives you confidence when you think about healthcare organizations and, what gives you confidence about their ability to make this shift? And
I'm hoping they will. And I'm hoping if you can just find one willing partner to do it with on a senior executive level to say, I want to try this. I want to try this. We want to try this. We want to set up the reward system with the competition plus the cooperation piece of it so that we will start to see it's not just about the winning, it's about the spreading and it's about the mentoring and coaching. And if you can get one leader to agree to try that, I think it's got to be grassroots because I don't think anybody's going to get rid of reward systems by themselves. It's not going to happen, and they shouldn't. But it's always been competition, even now today. So set up a friendly competition. That'll be the way to make everybody better. It actually won't. In my mind, it won't. Because someone will win, everybody else is going to lose. And now you walk away. Okay, well, what did that do? Nothing.
Yeah, maybe might lead to some resentment here and there. I mean,
it just upsets me that I hear it so much, and I think that is a strategy people think is still working, and it's just, where's the evidence that it's working? By the way, show me.
Yeah, you already have a high performing team. If you just keep creating competitions, they keep winning. You're not really changing or moving the needle. You just keep rewarding an already high performing team. Yeah, I love that idea. I think it's just kind of this hand in hand. Like, can't we have competition, friendly or reward systems and things, and a culture of co-opetition, though? And I really believe you can. I worked at a firm once where we had lots of competitions, but we also met regularly to trade best practices and train with each other and to challenge each other. And it was really a lot of very similar to what you're talking about. And I think it was a real healthy balance that reduce resentment because it wasn't just, they're so great. It's, yes, I want to mentor this person because their team is doing amazing, but they're also actually helping me become better, and my team's doing better because of it. And so it really leads to this collaborative camaraderie.
And I think a general majority of healthcare people, associates and people who went into healthcare get an intrinsic value out of helping others. In general, not everybody, but in general. So helping someone else do better is rewarding for most people. or for a large percentage of people will get joy out of that. So they're not only helping someone get better, they're feeling good about what they did today.
Absolutely.
You know what? I helped somebody get through this thing they're trying to get through. And when people start to feel intrinsically rewarded at work, then work starts to get better. Patients are going to win. Associates are going to win. Everybody's going to feel it because it's a culture, where I am glad to be here. I'm giving back. I'm helping others, and we're all doing better. The whole organization's going to win, which is always good for everybody.
It kind of goes to that real basic leadership concept that people talk about all the time, which is, when you teach somebody, you'll become a better leader anyway, right? When you have to teach a subject, right, you're more likely to show up for them, be prepared, maybe think about really what you are doing, right? And which is only going to sharpen your own game. So I think it's, the mentors themselves are probably learning just as much as the other units during this whole process.
Yes, they're doing their mastery work, that they are so good at this that they're able to coach and mentor others, which always makes them better.
Absolutely. Mm-hmm. Yeah, and I imagine that it also helps strengthen the leadership teams just through more communication, collaboration, and they're kind of in it together. Just so many fringe benefits from that.
So many. I mean, it's kind of, it would be a game changer, I think, honestly.
Yeah, I agree with you. Yeah, the culture is a game changer, but these are the actual things that really, when people say the word culture, these are the types of things underneath it which actually create that environment that I believe are actually meaningful versus just the buzzwords that people use.
Exactly. Yes, I agree with you 100% on that.
Well, Shirley, thank you so much for joining us, of course, firstly, and giving healthcare leaders a different way to think about performance. One of the most important ideas from today's conversation to me is that competition doesn't really have to create winners and losers. It can help us identify bright spots. Teams whose results are offering lessons for the rest of the organization. Identifying excellence is only the beginning. The real organizational value comes from some of those things we just talked about when those teams are supported, expected to share their practices and mentor peers and help each other improve. We also heard that, of course, the method matters, right? A strong result is not enough if it was achieved in a way that can't be sustained, repeated, or even ethically defended for those gaming their numbers. Mm-hmm. But genuine improvement, right? It strengthens our systems rather than encouraging people to game it. And of course, finally, healthcare, it's a team sport, right? It's sustainable success depends on recognizing the interdisciplinary teams, behind the outcomes, replacing shame with curiosity, and treating lower performing departments not as failures, but as learners, right? As an opportunity. Mm-hmm. Shirley, thank you for sharing such a practical, really, and constructive vision for building a stronger culture of improvement. I think it's going to be widely valued and adopted, hopefully, by our listeners. And to our listeners, thank you for joining us on Beyond the Bedside. Share this episode with a healthcare leader, who is working to improve performance, strengthen culture, or spread successful practices across the organization. And please leave a comment, like, or follow our podcast if you enjoyed today's episode. Until next time, keep leading with purpose, keep learning from your bright spots, and keep creating meaningful change beyond the bedside. Shirley, thank you again for joining us today.
Thank you, Michael.